Good evening, everyone, and thank you again for joining for another episode. I have been very concerned about the issue of maternal deaths for women of color, and in particular, Black women in the United States. As of the 2021 rates, Black women in the United States are dying at more than 2 times that of white women. And I did a total review of all the root causes for maternal deaths. What I'm hoping to do with these episodes is to really empower women and their families to really know themselves, to understand the health system in a much better way so that they know their options, and to be very much involved taking action when it comes to decision making regarding their pregnancy and their birth process and birth experience. This episode falls within our episodes on understanding the health system. Last night, we spoke with Marcia Ford in Atlanta, Georgia, who was a nurse midwife who did births pretty much in the hospitals and had begun doing home birth. Tonight, we're going to be speaking with Nicole Wardlaw, who is the owner and founder of Jemai Birth and Wellness Services in Chesapeake, Virginia. Prior to bringing on Nicole, out of the 3.6 million babies that are born every year in the United States, only 1.5% are born at home. And so we're thinking it would be a great time to educate everyone a little bit more about birth options that would be safe for low-risk women. And I also want to say clearly that home birth should not be something that you do by yourself. It should be a planned event with a skilled provider. So let me bring on Nicole. Nicole, thank you so much for being with us tonight and giving us your time. We're so appreciative of that.
Hey, glad to be here.
So let me give you a little bit of background about Nicole. Her professional career in midwifery has spanned over 15 years, and it includes health education consultancies, full scope midwifery services in public, private, and military facilities. And she's also been clinical faculty advisor for midwife students. Nicole earned her doctorate in nursing practice in 2022 from Old Dominion University. She got her bachelor's and master's degrees in nursing from the Medical University of South Carolina, completing her studies in 2005. Her desire to listen to women was the motivation that led her to midwifery, a specialty she has practiced since 2005. Yo, I'm getting up for a hot second because my beeper's going off for my burglar alarm, and this is real life, y'all. Give me a second.
Oh, man, that is so funny. Listen, life be lifing, and we all have these things that go on.
Oh, the last night we would need is a major burglar alarm, and it's pretty loud. Let me finish with Nicole. She sees herself as a partner in her patients' health care. She's passionate about working with women, individuals, and families to ensure safe and informed care. Her areas of expertise include sexually transmitted disease education and prevention in teen pregnancy, with a special interest in transgender care. Her passion for her community inspired her to open a home birth practice. Jemai Birth and Wellness Services is the home birth practice, and it's so that she's able to serve her community and work towards creating spaces for clients that want out-of-hospital birth. She's originally from Brooklyn, New York. She loves coastal living. So down in Chesapeake, Virginia, you're near that coastal living. She's the mother of 2 daughters, has 1 fur baby as well. And in her free time, she enjoys traveling, knitting, and exploring different cultures. So Nicole, we're here to hear from you tonight. So can you just tell us about your practice?
So the practice name is Jami Birth and Wellness Services. I started it in October 2020. So we're looking at almost 3 years of doing this.
All right.
And it is a family. I feel like Jami is a Swahili word. It means community. And one of the things that I wanted to do when I started this practice was to be able to serve my community. And so not only do my clients come in, I tell them, welcome to the family, because the relationship is not just during pregnancy. It extends past the pregnancy into, I mean, I may be their care provider, but my clients and sometimes my staff and my team will say, you need boundaries. But if my clients need me, they need me. And so many a day I've had someone call me, it'll be 11 o'clock at night or 2 in the morning or something like that, because there was something that they needed.
Mhm.
And even if it's not about medical care, maybe they need mental health resources, maybe they need, clothes or whatever. We try to tap into all of those resources. So it's more than just about the pregnancy. It's more about reaching a whole person in a very holistic manner and the whole family. So right now we're doing the care of my ladies and my birthing people, but I would love to expand this to include mental health, primary care,
Wow.
pediatric care,
Yeah.
nutrition, massage therapy, chiropractic care, all of the things. And I even had someone suggest to me, well, why don't you get a garden when you get your building? And I said, absolutely. We will do all of
Wow.
these things because we want to make sure that our community flourishes and grows from what we do in this place.
So you're carrying on the traditions of our grand midwives who we talked earlier episode how, what the role of the midwives were in the communities. They had a very important role, and they did more than just birth babies. They also cared for the social needs and the food and the clothing. So you're just carrying on that tradition. So we're so excited for you, Nicole. And I'm sure you're going to have that garden. I know you're going to have that garden. So I want to ask, you have done hospital births and for a number of years. So what made you decide to shift to home births? What made you decide to do that?
So I did hospital birth for 15 years of my
Mhm.
career. I've been doing this for now 18, right?
Okay. Yes.
And I always felt like I wanted to deal with people where they were.
Okay.
And I always wanted to serve my community. And I have a very a service spirit, right? Where
Hmm.
I'm always thinking about my community. I'm always thinking about how I can uplift the community. And so when I look at the statistics and I'm like, Black women are dying.
Hmm. Yes.
Why is it that our women, Black and brown women specific,
Yes.
are just not getting what they need, and they're not being listened to, and they're not being heard, and they're not being served? And in our hospital system, we have all of the technology and all the bells and the whistles, right? But why is it that our numbers look the way that they do? And then they talk about social determinants of health and all this other stuff. And I said, okay, well, but what about college educated women who die at a 5-time rate, right? If you have a college education, you should have a job, you should have health benefits, you should live in a place where it's not a food desert. So why is it that we're having this happening, right? And so I looked at other models and I looked at other places and I said, you know what? I really want to get in the community and give options to the women who, and birthing people who would may not think about this as an option. You know what I
Yes.
mean?
Yes.
And like in other countries, midwifery is the norm, not the exception. Out of
Exactly.
hospital birth is a norm, not an exception. We used
Exactly.
to be the norm. Like out of hospital birth was what was the normal thing until all of a sudden now we can integrate and get into the hospital, and integrating and going to the hospital did not do anything for us, but caused us to have these horrible health statistics. So
Yeah.
that was really my motivation and my drive to say, okay, let me give some options and let me be of service to my community. And there are clients that come to me, and everybody that comes to me doesn't have to have or want a home birth. So people think
Okay.
because I'm a home birth midwife that all of my clients are getting home birth. That is definitely not the case, because what they will come and I'll do their prenatal care and they will birth somewhere else, and then I'll pick them back up for their postpartum care. Also do
Okay.
GYN care, all of that is a part of our scope. And I also see the babies too. So that was really my motivation, was just to get in my community and be like, listen, you don't have to birth at home by yourself because you're so afraid to go in that hospital.
Mm-hmm.
I got you. We're going to do this together, and we're going to have a safe and affirming birth, or have safe and affirming care, and let's be safe with it. Like let's be empowered and educated.
All
All of
right. Exactly. I think it's an interesting point that you brought up, that not everyone who comes to you may necessarily end up with a home birth, that they might choose to have their baby in a hospital at another location. And when we spoke with Marcia last night, she also talked about the co-management, where you're working along with a physician. Um, can you tell us a little bit more about those women who may choose to have their birth in another location? How do you work with them? And they
So,
end up coming back to you, so that's a good thing too.
so I'm gonna say that in Virginia,
Yes.
as a certified nurse midwife and certified midwives and certified professional midwives are
Mm-hmm.
all able to practice in this state.
Yes.
So, and we have independent practice. As a CNM, I have independent practice. I have jumped through the hoops. I've done what I needed to do. I can practice independently. So I don't have to have a consultation agreement. I don't have
Okay.
to have a
Yes.
collaboration. I don't have to do any of those things.
Yes.
However.com, if I do have a client that risks out, that for some reason they need a higher acuity of care that I cannot provide in the hospital or even in my practice, I can refer them out to someone else. And that referral may be based on where they live. So
Okay.
it's not where I have, a doctor who is someone that I have a contracted agreement with. um, what I'll do is when I have clients that say in their prenatal care that they risk out and we know that they have to have a hospital birth, I'm going to refer them to a practice that can manage them in the hospital. If
Okay.
we are at the home and they risk out, then we're going to go to the closest facility.
Okay.
That in most of the time, I will say, let me knock on wood, every transfer that I've had so far has not been an emergency. It has been where I said, okay, this is what's going on. What do you think? Or I'm not comfortable. We need to go. Or mom just very simply said, or that birthing person just simply said, I'm tired. I don't want to do
Yes.
this anymore. And
Yes.
that is actually the number one reason for people to transfer out is just exhaustion because they're
Yes.
tired of the whole process.
Yes.
Um, but at the end of the day, we don't have to have that kind of a relationship.
Mm-hmm.
And if I do any type of collaborative management, it's with maternal fetal medicine.
Okay. Yes.
So we refer to maternal fetal medicine in this area. They will give their recommendations and send them back, but that's about the most that we do in terms of collaborative management.
So, for those who are not familiar with maternal fetal medicine, these are OBGYN doctors who have gone on to study maternal fetal medicine. They are the experts in high risk, and OBGYNs would also refer to maternal fetal medicine because they too cannot always manage everything. So I have worked as a nurse midwife with someone in maternal fetal medicine, and I think if there is a risk factors or high risk, I feel like it's almost the perfect duo is the midwife and maternal fetal medicine. Um, so, can you tell us what families would need to do if they want to have their baby at home? What kind of ways would they need to prepare? What do they need to do?
So I always tell my clients when they want to have a out of hospital birth that they have to think that this has to be normal physiologic birth, right? We don't have a
Yes.
NICU, we don't have anesthesia, we don't have anything that is hospital related in that home. So there's not like we gonna hit the bell and they're gonna get an OR ready or any of that kind of stuff, right? So it has to be normal physiologic birth. Like you got to go into labor on your own. You got to do this. Your body has to do it. The other thing is because we don't have pain meds, we have to think about non-pharmacological methods for pain management. So I
Right.
let people know you can't get an epidural in the house. So you're gonna have to get really mentally prepared for this. I strongly encourage my clients to get a doula, especially if they are a first-time mom or doing an out-of-hospital birth for the first time. Get a doula. Your doula is worth every penny spent, whether it's out of your pocket or your insurance company. I don't care. Get a doula because your doula is going to be your cheerleader. They are going to emotionally and physically support you through this whole process, right? I'm the clinician. So what I'm
Mhm.
doing is watching and making sure everything is happening. But I tell people I'm not a great doula. I might hug you and I might support you, but I'm not gonna be like, girl, get the bowling, get on the birthing ball and let's curb walk and let's do the mile circuit and all of that. I'll be like, you where your doula? I need you to get a doula. Okay.
Yes.
Um,
Yes.
but so that's some things. And we also have I have birth assistants or midwife assistants that assist me. I have a
Yes.
great team of
Okay.
them that come and they work with my client. They do a home visit with them to help them to get set up logistically for the birth. So they have to order their supplies. If they want a water birth, then we get them a tub. And so the assistant will go to the house and say, okay, this is where we should put the tub, or this is where we're going to set up your supplies. You know,
Mhm.
they want to know what the closest hospital is, what the layout of the house is. Like we got one bathroom or we got three bathrooms, you know, they want to
Mhm.
know what parking is looking like. Because by the time that logistical visit is done, it's go time. So we know when we're walking into this space that the supplies are there that we're gonna need, right? We know where the
Yes.
closest facility is in case of an emergency. We
Yes.
know, and I think that my clients start to mentally prepare for this, and they're like, okay, you know, I got my blankets, I got my towels, I got my washcloths, I got my trash bags. You know, we got to put the placenta somewhere. So I got my Ziploc bags, right? I got
Yes.
my all of the stuff that I'm going to need for this
Yes.
birth. And my assistants help them with that process in terms of like the physical stuff, how to
Mhm.
make the bed up, because
Yes.
there's this is a science to that. We have a double setup on the bed, right? Because the first layer is might get messy, but then we get
Right.
rid of that layer, and then you got the clean, fresh layer that when we tuck mama in or that birthing person in, like it's all good. So all of those things are what we do for preparation. So when people call me, they're like, well, can you just do my birth? I'm like, no, it doesn't. It's a process. And we
Yes, it
got to be
is.
prepared. We don't just show up at your house. It's not like when you show up at the hospital. We
Mhm.
have to have a relationship. There has to be some trust there. And that happens during the full course of the prenatal care.
So a lot for the family to do, which also there's an increased amount of responsibility for families who want to have their babies at home. Can you talk a little bit about the care for the baby once the baby's born? How long do you stay in the home? What's required for the baby's care? In hospitals, of course, everybody's there. You've got the pediatrician making rounds, but how is that different, and what do you need to do about that?
Okay, so as midwives, we are trained to take care of babies, right?
All right.
So and that's why I have to have an assistant with me, because that's now, instead of one human that I'm looking at two humans, right?
Yes.
So I've got to make sure that my baby is transitioning fine and my mom is stable. So my
Yes.
assistant is there, and typically we'll say, okay, who you got? You got mom or you got baby, right?
Mm-hmm.
So if I'm taking care of mom, I'm doing mom's vitals, I'm doing her recovery, I'm paying attention during this, this golden hour. My assistant has the baby, they're checking, doing all the vitals for the baby, making sure the baby is transitioning well. And if we flip flop, if there's anything that's abnormal, hey, Nicole, mom's blood pressure is high. I'm like, okay, well, let's look at it we'll recheck it. Let's see what's going on. Hey,
Yes.
Nicole, baby's respirations are a little fast, or the baby sounds grunty, or whatever the case may be. And we do
Yes.
interventions to make sure. But in terms of that baby, we do all of the vitals. We do the newborn assessment. We give the meds if parents want meds. We do all of that. So that's an immediate postpartum thing. And we're usually there a couple of hours after birth.
Wow. Wow.
Once everybody's like the checklists and these milestones are met, mom got to pee before I leave. Baby has to latch before I leave. Everything has to be stable before I leave. And once all of that is accomplished, then we give them space to be, like to bond at home, whether
Yes.
it's with, their other children, the family, whoever. And then I come back in 24 hours to
Okay.
do an assessment of mom and baby. Because in the hospital, right, they get an everyday assessment.
Exactly.
So they get an assessment. I do a weight check. I make sure that this little human is doing fine. And I always give discharge instructions. So my clients know if the baby's temperature is not this, they need to let me know. If the baby is doing this kind of breathing, they need to let me know. If her bleeding is looking like that, I need to know. All of those things, they get discharge instructions. And then I
Yes.
usually will see them about 48 hours after that. And then they get a 3 to 5 day visit with whoever is going to be the care provider for the baby. And then, but I turn them over. So after 48 hours, somebody else is looking at that baby besides me.
Okay. Okay. So incredible care. I noticed looking at your website that there were like 4 postpartum visits after the baby's born. A lot of women don't know that their health insurance may pay for postpartum visits even if they have their babies in the hospital. But if you're doing a home birth, it's already built in. You don't have to negotiate and say, can I have this? Can I have that? It's already there. So,
24, 48, 2 weeks, and 6 weeks. I do a 2 week check in with my clients. Some of them may not need it, but I make sure that I'm like, okay, by 2 weeks, one of the things I'm really concerned about is that postpartum depression. So
yes,
at
yes,
2 weeks, I'm like,
yes.
hey, how's it going? How's breastfeeding?
Okay.
You know,
Okay. Yes. Well, Nicole, thank you so much for giving us really a bird's eye view. For anyone in our listening audience who don't know quite what they want to do and you live in the Chesapeake, Virginia area, you most definitely want to look up Nicole Wardlaw and Jemai. Did I say that right? Jemai.
Jami,
Jami. Okay, I got
Jami.
to get my Swahili together. Jami. Jami Birth and Wellness Services. So, again, thank you so much. We appreciate your time. Wish you the very, very best as you come up on your year number 3 anniversary. And thank you. So, I just want to say for those of us who have liked the information that's provided, that you will like, that you will subscribe to my channel, that you will share this information to everybody. And as I say, share this with your mama, your brother, your sister, your father, your auntie, your uncle, your cousins, your nephews, your nieces, okay? Everybody, it's a community. So thank you again, Nicole. And again, thank you. We wish you the very, very best.
Thank you.
All righty, thanks.